This is an unusual collaboration between researchers, clinical researchers, particularly researching things that are clear or near the end of their development cycle, and providers and commissioners of care who are looking for evidence base to guide how they configure clinical services. So it's an attempt to get evidence-based research into clinical practice to produce science that's very relevant to care packages out there in the community and at the interface with hospitals, and assisting people providing that care to do that in the most cost-effective way. Naturally, we can't look at everything to do with healthcare, so we have focused, and we've got 5 main themes that we're looking at. The first relates to innovations in health and early interventions, and that's looking, for example, at things like different ways of handling vulnerable elderly patients who become acutely ill without necessarily routinely admitting them to the hospital, which is what tends to happen now. We have a theme that's looking at health behaviours and behavioural interventions, and that's mainly currently focusing on low back pain, one of the commonest causes of major disability, very high cost to society. We also have something that's looking at patient experience of illness and being able to measure that more effectively through patient-recorded outcomes. We have a programme that's looking at comorbidities. That's becoming quite a topical area, the fact that patients often, in fact usually, have more than one illness coexisting, and a very important coexistence is between mental health problems and physical illness. And the final theme is looking at patient self-management. Obviously important for patients to become more involved in their own care, but potentially a better way or more cost-effective way of providing services. We've had a very busy and productive first 2 years, and what we're now doing is thinking about what we'll do for the remaining 3 years of this programme. What we're particularly going to do is widen the research groups that are involved with the CLAHRC, so we hope to have more examples under each of the themes, and also widen the engagement with stakeholders.